Not every health problem requires a trip to the emergency room, but some do, and knowing the difference can protect both your health and your peace of mind. Many everyday symptoms appear suddenly: a headache that won't go away, a deep cut while cooking, a painful ankle after a fall, or a child with a high fever late at night. In those moments, people often face a difficult decision. Should you try a home remedy and wait, or should you go straight to the emergency room? This choice can feel stressful, especially when symptoms are uncomfortable but not clearly severe. Some people rush to the hospital for conditions that could safely be handled at home. Others delay seeking help for symptoms that actually require immediate care. Understanding a few basic principles can make this decision much easier. The first step is recognizing what home remedies are designed to do. Home remedies are typically meant for mild symptoms and temporary discomfort. These approaches may include rest, hydration, cold or warm compresses, simple wound cleaning, or over-the-counter medications. They help manage symptoms while the body heals naturally. For example, a mild headache after a long day may improve with rest and hydration. A small scrape can often be cleaned and covered with a bandage. A mild muscle strain might respond well to rest, ice, and gentle movement later on. In these situations, the body usually repairs the problem without the need for medical intervention, but the difficulty comes when symptoms look mild at first but are actually more serious. Many conditions begin quietly before becoming more severe. Because of this, it's important to recognize the signals that suggest professional medical care may be necessary. Point 1 of the most important warning signs is severe or sudden pain. Pain is the body's alarm system. While mild discomfort can often be managed at home, intense or rapidly worsening pain may signal something that requires medical evaluation. For example, sudden chest pain, severe abdominal pain, or intense head pain should never be ignored. These symptoms can indicate problems that need immediate attention. Another important factor is difficulty breathing. Breathing problems are one of the clearest signals that emergency care may be needed. Shortness of breath, wheezing that continues to worsen, or the feeling of not getting enough air can indicate serious conditions affecting the lungs or heart. In these cases, waiting at home may not be the safest option. Loss of consciousness or confusion is another situation where emergency care is often necessary. If someone faints unexpectedly, becomes disoriented, or struggles to respond normally, it may indicate a problem affecting the brain or circulation. Even if the person appears to recover quickly, medical professionals often need to evaluate what caused the episode. Bleeding is another symptom that helps determine the appropriate response. Small cuts that stop bleeding after a few minutes of pressure are usually manageable at home. But bleeding that continues despite steady pressure, or wounds that appear deep or wide, often require medical treatment. Professional care may be needed to close the wound properly and prevent infection. Injuries involving the head, neck, or spine should also be taken seriously. A fall or accident that causes strong neck pain, difficulty moving, or dizziness may involve deeper injury that cannot be assessed at home. Another category involves signs of infection that continue to worsen. A mild sore throat, small wound, or mild fever can often improve with rest and hydration. But if symptoms become progressively worse, such as high fever, spreading redness around a wound, severe swelling, or persistent vomiting, medical evaluation may become necessary. The key challenge is that many people try to make this decision based only on how uncomfortable they feel, but discomfort alone is not always the best indicator of danger. Some serious conditions cause only mild discomfort at the beginning, while some harmless conditions can feel surprisingly painful. Instead, it can be more helpful to look at patterns of symptoms. Is the symptom improving, staying the same, or getting worse? Is the pain manageable, or is it rapidly increasing? Are there additional symptoms appearing, such as dizziness, weakness, or difficulty breathing? These patterns provide better clues about what the body may be experiencing. Another practical guideline involves how long symptoms last. Many mild problems improve within several hours or a day with simple care. A headache may fade with rest. Minor stomach discomfort may improve after hydration and light food, but symptoms that continue without improvement or gradually worsen may require professional attention. Children and older adults sometimes require extra caution. Young children may not always describe symptoms clearly, and older adults may experience complications more easily. In these cases, it is often better to err on the side of caution when symptoms seem unusual or persistent. The most useful way to approach this decision is to think in terms of 3 simple questions. First, is the symptom severe, sudden, or affecting breathing, consciousness, or major pain? Second, is the condition getting worse instead of better? Third, Is the injury or illness something that cannot be safely managed with basic care at home? If the answer to any of these questions is yes, seeking professional medical care becomes the safer choice. Home remedies play an important role in everyday health. They help manage minor symptoms and support the body's natural recovery process. Emergency rooms serve a different purpose. They are designed for situations where symptoms may indicate serious injury or illness that requires immediate evaluation and treatment. Both options are valuable. The key is understanding when each one is appropriate. By paying attention to symptom severity, progression, and warning signs, people can make calmer and more informed decisions about when to manage a problem at home and when to seek medical care. These decisions become much easier when you focus on patterns rather than reacting only to discomfort. If you found this explanation helpful, consider subscribing to the channel. The goal here is to break down everyday health and safety decisions into simple, practical ideas that are easier to understand. And if you want to explore this topic further, there's a useful resource linked in the description that goes deeper into first aid and emergency awareness, so you can review it at your own pace.